This is a recorded lecture for Chapter 4, Information Technology for Health Professionals. And what we're going to look at in this particular chapter is telemedicine. Telemedicine is interesting in the sense that globally, internationally, it's just blossomed, it's exploded, it's volcanic as a matter of fact, because people, or doctors or providers of care from one site can provide health care to a totally another part of the world, and that's everywhere but the United States. The United States, we have kind of an interesting dichotomy in the fact that we can provide health care to other nations using telemedicine, legally and logically, but it's very difficult to provide telemedicine from one state to the other. Now we can do that, but for a physician to provide health care via telemedicine from one state to another, he or she must have a license in both states. So if they provide health care to 20 states, they have to have licensure in 20 states. One of my previous positions was the Chief Operating Officer for Radiology Associates in Albuquerque, New Mexico. And we had a large telemedicine system, teleradiology system. We provided radiology services for over 15 states. And so we had to go through the process of getting licensure in those 15 states for our physicians, and sometimes that was always in process. So we had to be careful about who we put on to do the teleradiology because some of them couldn't handle certain requests from certain states because they weren't licensed in that state as yet. So you see that mechanism, or that difference, if you will, that problem in the United States, because we have state licensure, which is different from state to state. I'm a big proponent of national licensure. As a PA who practiced almost 30 years, I think that national licensure should have come a long time ago, because state to state there are different regulations and legislations from state to state which are prohibitive in delivering good patient care based on how they're different from one to the other, and there's all sorts of differences. So some simple examples are, for instance, medical assistants. Medical assistants in some states are licensed through the medical examiners, which is the same as physicians. And medical assistants in other states are licensed through the Board of Nursing. Now, that doesn't sound like an important issue, but here's the difference, is that medical assistants that are licensed through the Board of Nursing have to go through the Board of Nursing, have to adhere to Board of Nursing regulations and such, and they are licensed so when a medical assistant goes out and practices medicine, they practice under the RN that's in the building, so to speak, or the nurse that's in the building. If a medical assistant is licensed through the Board of Medical Examiners, physicians, that means that they are licensed directly to the physician, and the physician dictates what they can and can't do. What that means is that if the physician wanted them to do neurosurgery in an office situation, which they probably wouldn't, obviously, but they could, because they practice under the auspices of that physician's license. Now, the physician could be called to task if they did that, of course, but they could do lots of things that are pretty in the gray area. A physician can have a MA work as a surgical assistant for minor surgeries, even though they might not be trained in that. So there's some real issues, including quality of care, and we'll look at some of those. So telemedicine uses computers and telecommunication lines to deliver health care at a distance from not in the same brick and mortar area. Telemedicine can use store and forward technology, transmit still images or interactive video conferencing for real-time consultation. So it can be used, for instance, for the PAC system, what we talked about in the previous lecture. We can talk about the storage of radiology pictures, if you will, images, and they can be stored and then transmitted back and all that kind of thing. Or you could do video imaging where you do real-time consultation. That happened in Beijing when they had a bad earthquake a few decades ago, and they had a shortage of specialized surgeons. All they had were really general surgeons. And the people at Syracuse, the medical schools at Syracuse and Georgetown were able to provide telemedicine consultation by specialty surgeons to help guide the general surgeons to do the work. And so they provided this consultation. So as I said, we're very good at doing it from country to country, not so much from state to state. This is called a metaport, and this is basically a mechanism we'll see a little later. We'll talk more about what it does and doesn't do in just a bit. And a quadruport is a portable computing platform enabled to high-definition video conferencing capability, which allows people to consult. You see where you're at and where they're at. You can see all sorts. It gives you 4 different views, if you will, of the information. The device allows remote medical specialists to interact with patients, provide expert counsel, which is especially important for rural clinics and field hospitals with limited medical staff. And live surgeries can be shared remotely for the purpose of mentoring, and better clinical outcomes are enabled via bedside access to patient data and well-based resources. So this is a pretty cool thing, this quad port, so to speak. Now, interactive video conferencing, a telemedicine consultation, involves a doctor at one site with a patient at another site, and again, outside the normal brick and mortar's local area. This is a good example. So here's a doctor and a patient, if you will, conversing, in this case probably a nurse and a doctor, having this conversation, or a medical person with a physician at the other end having this consultation. Could be any of those things. By 2010, there were about 200 telehealth networks in place in the United States, and they're linked to more than 25,000 or 2,500 institutions. That's pretty extensive when you stop and think about it. So we can extend our reach and our growth from one site to another. The Veterans Health Administration has 50 health management programs in 18 integrated networks. That was in 2011. And it's found that remote monitoring reduced the number of bed days by as much as 25%, a fourth of bed days, and it reduced admissions by as much as 1/5 or 20%. So you can see that telemedicine really provides that care, and instead of waiting for a consultant to come by and see that patient, that consultant may or may not be able to see that patient more quickly, more instantaneously. Telemedicine has been used in prisons for years, and the prison population is growing, and so providing health care, specialized health care, to the providers of care in the prison population is really important. Now, Bluetooth technology we use on our phones quite a bit. It can connect various devices so that, for example, when a pacemaker senses a dangerous event, the call automatically calls 911, and we see that in some of the pacemakers that are being put out there now. So that Bluetooth gives us that access for that we can be a more timely response. Now, there are several specialties of telemedicine. It really falls into whatever area we're talking about. Teleradiology, which I talked about, providing radiology services. Telepathology, which is looking at tissue samples. Teledermatology, where we can provide dermatology consults at a distance. Teleophthalmology, so we can provide ophthalmology consults. Telecardiology, provide cardiac consults. It goes on and on. And teleneurology, neurological consults, including telestroke, where we look at diagnose and treat strokes from far. A treatment of epilepsy and Parkinson's disease from far. Telehome care, so we use remote monitoring devices for home care, and we can manage that process, people's care at home without going there actually. And teleradiology is really the oldest form of communication. It's been used quite a bit. Telecommunicating radiological images, they can be stored and forwarded, so you store them and forward, and they can also be real time. You can take the actual image, and a radiologist can direct how that image is done, or certain views of that image right there as if he or she were right in the room. Telepathology is viewing microscopic images at a distance on a monitor, and they can be stored and forward, which means the facility stores them and forwards them digitally, or they can be real time just like the teleradiology. Teledermatology and teleophthalmology, dermatology meaning the side of the skin, ophthalmology of the eye. Teledermatology is the practice of dermatology over telecommunications network. They can be stored and forwarded, so pictures are taken and forwarded, or there could be interactive video conferencing, including the interview of the patient. Teleophthalmology is using telemedicine to study the eye from afar. So you could have a telemedicine would allow you to, if a person was doing a fundoscopic looking inside the eye, they would be able to see that from afar and to help guide and help you make decisions, help experts make decisions. Now, telecardiology in the 1960s being possible to transmit heart sounds accurately into fax EKGs or ECGs. In 1990, ECG and EKG are the same thing, by the way. In 1990s, echocardiograms could be telecommunicated also, so they could be moved back and forth, and so they didn't have to be sent the old slow way. In telecardiology, second opinions via telecardiology are one of the most common requests in telemedicine today because people come into rural emergency rooms with chest pains and many ER doctors want an expert consultation, so they can get that through telecardiology right there in the emergency room. In 2009, a study in Italy found that telemedicine could correctly diagnose heart attacks in elderly people at home. So they have instituted almost a computer-to-computer system that helps them to diagnose those at home and to get people, they could eliminate the people that didn't really have heart attacks, and they get faster care for people that did. So the use of telecardiology both improved diagnosis and deliver that treatment more quickly, as I said. A major area of growth in telecardiology is the diagnosis of infant congenital heart disease. We are able to see children that are having difficulty in rural areas that can get their consult from far away, and that's really made a major change. In teleneurology, it uses email and video conferencing so the neurologist can diagnose a neurological disease at a distance. Teleneurology is also using email for making referrals back and forth, and video can be used to study the gait or the movement of a patient or the neurological evaluation of a patient. We use it for stroke, so telemedicine is particularly important when time is a consideration, is when somebody may or may not have a stroke. So telestroke patients can be evaluated by experts miles away to see if they need TPA. That's a clot-busting drug, which is used to be administered within a few hours of the stroke, and it has to be actually be within the first hour to be most effective. So if they can use TPA initially to clot bust that clot, then they can save that person from having long-term detrimental effects. Epilepsy, in 2005, a study found that outcomes were the same for patients treated by telemedicine accompanied by a nurse as for those treated by a physician. So we can start to, so physicians, their breadth and scope becomes much wider by the use of telemedicine. Teleneurology and Parkinson's disease, recent study and pilot programs in 2009-2011 have shown that telemedicine can be useful in the evaluation, monitoring, and treatment of patients with Parkinson's disease. So people in rural communities or people in isolated communities can receive diagnoses and begin treatment for their Parkinsonism. That's really important because most of the time that the treatment gets delayed, sometimes because of distance and accessibility, and so that can be fixed basically through this mechanism. And telepsychiatry, used in areas with a few psychiatrists, can be an effective treatment for some conditions. It's not appropriate for all conditions, obviously, but it is useful for some conditions where you can do some psychiatry work via telemedicine. Now, remote monitoring devices make it possible for patients to be monitored at home from afar. The new experimental devices embed sensors in wearable fabric that the patient wears that allows you to sense when a patient may be having an epileptic seizure, maybe having arrhythmias or some problem with their heart. It allows them to do that. So this is data from a digital spirometer which looks at the breathing mechanism from a patient so that the health record can show that they're having better or worse breathing based on a series of events. We have telewound care, so elderly, frail patients and patients in poor health are more likely than others to suffer from problematic wounds, and increases the healing rates and decreases complications, so that wound care can come from afar, either from a healthcare provider to the patient who does the actual treatment, or from a physician to a home healthcare nurse that helps do the treatment. Telehome care involves a link between the patient's home and the hospital or central office that collects the data. Equipment, which now may be as small as a smartphone, is used in the patient's home, so they can do home care, do home checks to see, is the patient doing okay, how's their breathing, how's their heart rate, that kind of thing, to make sure everything's okay. And so they don't really have to put a body in the patient's home to monitor them like they used to. In 2010, approximately 31,000 people used the VA telehome care. Automated robots are being used to make house calls now, and it's kind of interesting how that works. They are able to, they have robots that can basically go in and do the measurements that are needed and all that. Homes can be equipped with sensors that allow adult children to monitor their parents' movements, so that they have an elder person at home, they can monitor their movements and make sure they're okay. Cardiocam uses a slight variation in skin tone to measure the pulse, so they can do this video can measure the pulse of a person to make sure it's regular. In telehome care, the patient can telecommunicate vital signs to a nurse at a distant location and can also speak to the nurse via this telehome care, which allows that nurse to, instead of spending time traveling to homes, is able to basically go much quicker, see more patients, take on a bigger load because he or she has a greater scope. So telehome care has been found to cut rehospitalizations, ER visits, and to reduce hospital stays. So there's value in that process. Now, telemedicine in prison is cost effective. It enhances security because if there's less people at risk, it improves medical care, and both inmates and prison officials really appreciate that access. It gives them a greater scope of care based on that. Other uses of telemedicine are the baby care link, RetCam, which is to diagnose retinopathy of a prematurity, the treatment of Alzheimer's using most detectors to monitor patients. It can be used in daycare, teletrauma in Vermont and Arizona. So other uses of telemedicine have really been extensively used, including weight management, pain management, spinal cord injury, podiatry, study of the treatment of the feet, teleo-oncology systems, so you're looking at help cancer patients avoid lengthy trips to doctor and feel more secure because they have a 24-hour link to healthcare. So they're getting cancer medications, and yet they can still have more regular care, and they don't have to wait until something goes south before they can see anybody. Satellite, which uses smartphones and PDAs to deliver information to healthcare workers in remote areas. Telenurses and doctors are using what's called the EICU Smart Alerts and other EICU systems to monitor intensive care patients from afar and send alerts to ICU personnel. So a telenurse can monitor a heart rate and what's going on with the patient in intensive care, and fill that information, and then send information back to that intensive care unit on something that's going bad. A virtual bot helps perform autopsies by scanning the body and taking high-definition images, which are then combined with images from the CT scanner to create a 3D image of the cadaver. So we can start doing autopsies without basically exposing the body. A lot of autopsies can be done just by doing this mechanism. We have silicon brain implants to monitor and control epileptic seizures, which have been developed by the University of Illinois Tufts and the Pennsylvania School of Medicine. The iBrain in all clinical trials is used with people with sleep apnea, and the Q sensor helps to measure stress levels. In telenursing, we have teletriage, so patients can be triaged by a triage nurse from afar. Telecommunication of health-related data, so a nurse can provide health information to patients from far away. We can develop remote house calls, so we can, if we want to check on a patient. We can also monitor chronic illnesses or diseases using telenursing. Now, smartphones have really innovated the industry. New health-related applications for smartphones are being developed, like Airstrip OB, tumor analysis, fitness and weight control programs, stress reduction programs, medication reminders. All these are available and can be connected to healthcare systems to sort of monitor that process. And there's a set of touchscreen mechanisms so you can monitor what's going on with the patient. Pretty handy, actually. We have tablet computers, and there are telepath mobile computing devices. The users are taking notes from patients, so we no longer write those notes. We can type them out on a notepad, or we write them out, and they're then changed to text. Accessing records quickly, accessing medical references, and viewing medical images. All those can be done much quicker, much more quickly than before. We can use clinical applications like medication checker to see if that medication has a problem, interaction with one of their contraindications with the medication they're taking now. Looking at drug databases to see what our choices are. To make sure we're HIPAA compliant in that process is really important, so we're not endangering the person's privacy and security. There's a good look at the pads, and they come from iPads to 1 million Androids, if you will. Now, there are technical, legal, insurance, and privacy issues that go along with that. An appropriate telecommunications infrastructure has to be in place. In addition, several issues need to be addressed, such as licensing, and I've talked about that from state to state, medical liability, insurance, privacy concerns, reimbursement. It's really important because if we're going to do a remote home visit, home health care, does that get paid the same as when a nurse actually goes to that site? Is telemedicine effective? There have been many, many studies but it says but few solid conclusions, and I disagree with that. There have been some very excellent conclusions. Say telecardiology in particular is both effective and efficient, and a lot of these different telemedicines are actually pretty efficient. Now there are some extremes to that and some limits, but all in all, as far as a good portion of what happens in this care, telemedicine can provide that in a way that's cheaper and expands the distance and scope of a given provider. It has the potential of making high-quality healthcare available to anyone, regardless of where they're at. So if you're in the middle of nowhere, 500 miles from a road, you could get healthcare as long as you had access to the internet. So we looked at telemedicine in this chapter, and I really, my first thesis, which I did in my medical degree, was done on telemedicine. I've gone back and looked at it. I'm not going to provide it to you guys because it's so antiquated. It was done in the 1990s, but it had some predictions, and I was kind of proud of those predictions, and that is that telemedicine would expand as technology expanded. I had no idea how fast that was going to happen, and the fact that phones would become the source of telemedicine information and communication. But I was kind of happy when I looked at it again to see that I'd made some predictions that have become true, have reached fruition. So this has been a look at telemedicine. Thank you very much. Have a good day.